We are now going to see how to do Kaplan-Meier method in SAS. We want to compare survival time in 25 patients with multiple myeloma randomized to two drugs. Multiple myeloma is a type of white blood cell cancer that affects mostly men with an overall 5-year survival of about 40%. The most common cause of death in these patients is kidney failure. So for this study, we have these variables. DUR is the time of event or time censored in days. Status indicates if the observation was censored or not, where 0 stands for censored and 1 stands for event or death. Our first exposure is the treat variable that has two categories of treatments, that is standard and new drug. Standard is indicated by 1 and the new drug is indicated by 2. The second exposure in our study is renal function at the time of randomization with categories of impaired or 1 versus normal or 0. So this slide shows the data step in SAS. We have our data set, that is Epi 845. Then we have our variables in the input statement, and finally our data under the cards statement. Have a look at the data in the previous slide and try answering these questions. How many patients received the standard therapy? How many patients died at or before 8 days? What is the probability of surviving at least 8 days? When is the first patient lost to follow up? So the first question was, how many patients received standard therapy? The standard treatment is coded as 1 in our data, and the numbers with red border around them are the ones who received standard treatment, the total being 12. Second question was, how many patients died at or before 8 days? There are 2 events at 8th day. Next question is, what is the probability of surviving at least 8 days? So we started with 25 patients, and at 8th day there were 2 events, and there was no censoring until 8th day. So we had 23 alive patients. The survival probability would be 23 divided by 25, that is 0.92 or 92%. The last question was, when is the first patient lost to follow up? Looking for the status 0, the first patient was lost to follow up at 365 days. Here is the SAS code for KM method. The ODS graphics on and the ODS graphics off at the end are used to produce plots. We use proc live test and specify method equal km. The plot option will give you 3 types of plots as indicated here, which you do not need to worry about much at this time. Next, you need to write time duration into status. The 0 here indicates a censored observation. This is an overall survival plot generated by SAS through the option plots is equal to S. We can see that the overall survival probability is decreasing with time. From this plot, we can also see that the probability of surviving at least 8 days is 0.92, and the first censored observation, that was at the day 365. From this survival output as well, you can see that the probability of surviving at least 8 days is 0.92, and the first censored observation is at 365 days indicated by the asterisk. So what is 0.88? It is the probability of surviving at least 13 days. So here is a simple quiz for you. Looking at the output below, what is the probability that a patient will survive 180 days or more? It is 0.56 or 56%. Continuing with the SAS output, this one shows the median survival time for the study participants. At this time, half of the participants are expected to be alive. For our data, it comes out to be 210 days. This is the cumulative hazard function plot and is obtained from the plots is equal to ls option in SAS. So what is a hazard? A hazard is the instantaneous risk of a particular event at time t. You don't have to worry much about these plots at this time. This one helps us to see if the hazard is constant over time or not. If the line is straight and not curved, the hazard is constant. If the line is curved up, the hazard increases with time. And if the line is curved down, the hazard decreases with time. In the present case, the hazard decreases with time because the line is curved downwards. These plots affect how you set up your regression model if you use a parametric model such as PROC-LifeReg, where you actually need to decide which distribution you need to use. This is a plot from another study just to show you how the line for a constant hazard looks like. This is another plot that we can generate along with the KM analysis in SAS through plots is equal to LLS option. Again, do not worry much about this curve. All you need to know is that if the curve is straight as shown in this picture, then survival time follows a Weibull distribution and not an exponential distribution. This would become relevant if you use a parametric model such as PROC-LifeReg for your regression analysis.